Well, let's get more on the medical issues that could be involved and bring in Dr. Durrani, who's an emergency medicine physician. Doctor, thank you very much for taking the time to speak to us. I mean, as we looked at the images, of him falling that way, that was just so jarring, so scary. But what can you glean from what you saw?
Yeah, even in a hospital setting, when someone has CPR, it is a jarring and kind of traumatic event for staff members, for those around. And so the fact that this was something that, thousands of people were seeing in a stadium and on their televisions is a traumatic event. What we saw was the athlete having a certain type of impact, getting up, and then falling down. In medical terminology, we call that syncope. So he passed out. Then obviously the medical personnel rushed to him and noticed that his heart rate was not there, right? He was pulseless. And so that's when CPR was initiated. That's about all we know for a fact. Everything beyond that is, stuff that comes to mind as physicians in terms of, a few different possibilities, but those are the facts that we know. The good news is that in that type of situation, if your heart stops, the best place to be is in a hospital. The second best place is probably right where he was, where there was numerous medical personnel, and he was able to be, resuscitated and gotten to a hospital very quickly.
Yeah, and the medical team, from what I understand, was very quick to respond. I mean, how critical, Doctor, are those several minutes after a collapse like this?
Very, very critical. Out of hospital CPR, when you look at studies over the decades, the number one chance that you get at a close to full recovery is getting CPR initiated as fast as possible. Every minute you don't have CPR, that decreases your chance of likelihood. So he had CPR immediately. They hooked him up to an AED. Now, we don't know if he was shocked or not, if he had a heart rhythm that was shockable or not, but that was another good step. And the fact that they got his heart rate back and that his heart was beating again before they transferred him to the hospital is a very positive sign.
And Doctor, I mean, in Europe and in many parts of the world, we've seen football players, soccer players collapse, but I can't remember hearing of this happening before. I mean, how common is this type of injury? Is this a 1 in a million chance here?
Yeah, so as I mentioned, there's, right now everything is conjecture. So the kind of
Yeah.
theory that a lot of physicians that comes to our mind is something called commotio cordis, right? So it's this high impact to the chest that leads to the heart going into a lethal arrhythmia, what's called ventricular fibrillation. Very, very rare, almost as rare as a lightning strike. The good news is the treatment for that is CPR, getting hooked up to an AED, and a lot of times the AED will recommend shock and getting shocked out of that rhythm. Now, we don't know if that's exactly what happened here, but that's kind of the leading guess for most physicians who saw this. Now, it could also be a brain injury, a vascular injury, a variety of other things. But what happened here obviously was very rare. And obviously, he's in the best care in ICU to figure out what happened and give him the best chances at a recovery.
Indeed, and he's young and in good health. What would you say is a prognosis for something like this?
Yeah, so he is still in a very critical state. What I can say is he had the best chance at a recovery that anyone could get, which, I'll kind of harp on again, is, having that immediate CPR. And I think it goes to show that we should all know how to perform CPR. This could happen to a loved one at an airport, at home. And so the fact that he got CPR immediately, and then the fact that they got his heart rate back, because that's no guarantee, right? You could perform CPR, perform shocks, and getting your heart beating again is no guarantee. So those two things are good positive signs, but right now anything